When you work in a hospital system, it's a team sport. If equipment isn't cleaned and disinfected, and when required, sterilized properly, it doesn't matter how skilled the caregivers are, because they're working with that equipment, and they're not going to have optimized care delivery unless it's sterile when it needs to be sterile. So that one's very exciting for us.
Public health. It's on everyone's mind these days, from hand washing to emerging pathogens. Welcome to Transmission Control, an infection prevention podcast focused on your appetite for trailblazing thought, discussion, and innovations that will help you make informed decisions. Each episode, we speak with public health experts and safety champions from across the globe as they share their experiences, passion, and opinions. From investigative journalism to medical publications, we tackle real-world barriers to halting the spread of disease. Whether you are tuning in for education, inspiration, or to hear the stories that need to be told, thank you for joining us. And now, get ready to blast off with your weekly injection of insight on transmission control.
This week on Transmission Control, we speak with Pamela Arora, the new president and CEO of AAMI, the Association for the Advancement of Medical Instrumentation. And Larry, I know you and I are both very familiar with AAMI and the role that it plays in the industry, but we're going to share that overview with the audience today. And we're also going to be talking about Pamela's first week on the job, which was last week, and pretty in-depth effort on sterilization. So we'll get a lot more details on that and how people can get involved in AAMI and the creation of standards.
Yeah, being involved in the writing of standards is going to be something really interesting and important for us to talk about and address. And other questions that we're going to get answered. What exactly is AAMI? How is it structured? Who contributes to AAMI? How are these standards written, and how do we universalize them so that others can use them? And if there are problems with them, how can we change the guideline writing process so that all voices are heard? I think that's another really important point of this, and looking forward to addressing all those topics and hearing about AAMI and, for example, ST91.
All right, we're going to be right back after a short break with Pamela Arora, President and CEO of AAMI. I'm Justin Poulin.
And I'm Dr. Lawrence Muscarella.
From 17 Studios, let's get into it. This is Transmission Control.
Joining us now is Pamela Arora, President and CEO of AAMI, the Association for the Advancement of Medical Instrumentation. And Pamela, this is only your second week on the job, so I know it was a busy first week, and I appreciate you fitting us into the early days with the organization. Thanks for coming on the show.
Thank you. I really appreciate you fitting me in, Justin.
So what I'd love to do is first do an introduction to AAMI. I'm sure that most of our audience knows the organization and the work that you're doing there, but I thought you could provide a quick overview, and then we'll talk a little bit about your background.
Absolutely. AAMI's strengths lie in convening the right experts from across the healthcare space and identifying the right discussions to drive progress. That there's major areas around standards that we work, as well as the education of those that are in the clinical care delivery to leverage those standards and to deliver safe, quality care. It's a powerful mission, and it's a pleasure to be part of the organization as their CEO.
So let's talk about your experience and where you come from and your background. And I know you're based in Texas, and you've been there at least for a little while based on your recent employment. Tell us about that.
Absolutely. I've had an opportunity to work in many technology industries, but I ultimately found the medical industry attractive due to a lot of untapped opportunity to apply new and evolving technologies. I was drawn in particular because of the complex challenge. But I will say that drew me, but it was the mission of healthcare that kept me. Making life better for patients on a day-to-day basis, you can only achieve that with dedicated caregivers supported by effective technology. And I'm also going to offer that standards component actually helps with the efficiency across the entire industry. It's an exciting place to be. But for the last 14 years, I served as CIO at Children's Health System of Texas, and eventually went on to be their SVP of Strategic Technology. It was there that I discovered that AAMI was helping our biomeds, our HTMs, stay on top of technology evolution. And when I was aware of that, I decided to get involved with the association directly.
So our audience is largely infection prevention. And you talked a lot about, your work in technology and as the chief information officer. And I can say there's been, at least over the last 5 years, if not the last 10, an increased focus on just privacy and, cyber attacks, et cetera, within healthcare organizations. And I realize maybe on the facade of things to the audience that they don't see how that might connect to infection prevention. But I think you just connected it for us in talking about the departments that you supported, like biomed. And so I wondered if you could sort of even connect technology to infection prevention, because I think that would be a unique angle for our audience.
Absolutely. I will offer that care delivery, it's a team sport. And when you're in that environment, we need to have all the components come together. You mentioned cybersecurity, for example. There's a clear consensus that how we use and protect data is key for proper use of evolving healthcare technologies. When you look at sterilization, they're part of that ecosystem. And interestingly, everybody's touching technology these days. So from that standpoint, historically, I'll say way back when, you'd have these isolated biomedical devices that would be doing the different needs within the hospital systems and the clinics, but everything's getting far more integrated. And as we do that, it makes it much more powerful. There's new solutions that can come out of that when you talk about machine learning, artificial intelligence and such, quality checks that can be done in conjunction with technology. But that's something that AAMI is capitalizing on, because we need to educate professionals and standardize best practices for anywhere medical devices and other healthcare technologies as they're developed, utilized, and maintained. And that maintaining aspect of having safe quality care, sterilization is right smack in the middle of that.
Well, and there's the second A in AAMI, which is advancement. And I think that tees this conversation up nicely. And you talked about sterilization, which is basically what you spent your first week on the job immersed in. And so I thought you could talk about last week and how it went for you as the new president and CEO and what that transition's been like. I'm sure you're off and running.
Yeah, well, it's been an honor, and it certainly has been a pleasure talking with our various volunteers. This past year, our community of volunteers developed standards, and from this sterilization process week, we were able to kind of work through and finalize some. It proved particularly productive as it gave us the opportunity to review the work and discuss next steps. I'll give you some highlights. We launched the ANSI AAMI ST91 for endoscope reprocessing. And this is the standard that's responsible in health systems and facilities that are working hard to adopt this particular approach, where you're basically making sure that the sterilization is effective so that when those procedures happen, everything's a go. When you work in a hospital system, it's a team sport. If equipment isn't cleaned and disinfected, and when required, sterilized properly, it doesn't matter how skilled the caregivers are, because they're working with that equipment, and they're not going to have optimized care delivery unless it's sterile when it needs to be sterile. So that one's a very exciting for us. As far as additional standards, I can mention some of the updates from the session, but I didn't know if you had any other questions on that particular area.
I had some questions on ST91. I think that it's a very comprehensive document, to be sure. Is there any aspects of ST91 in particular that you would like to talk about as being kind of cutting edge and replacing something that had been ignored or maybe did not get enough attention, but that you think the ST91 is standing out as being particularly important in advancing?
Absolutely. I am going to clarify that AAMI is a convener of the experts. So the experts, these stakeholders across industry came together to figure out how to advance. And it's helping to make the cleaning and disinfection steps described by the manufacturers in the device instructions for use, the IFU, consistent, making it easier for professionals at clinics and hospitals to understand and implement them. It's interesting because things happen so quickly when you're at the front lines of care delivery. And if you have all these different ways of doing it, sometimes it creates not only inconsistent care, but in some cases unintentional issues relative to that care delivery. So what we're trying to do is make it easy to do the right thing. But AAMI's role of the convener is making sure that all the stakeholders, that multidisciplinary group, comes to the table and figures out what is that best approach. And we're really excited about this particular launch.
So Pam, the whole process of writing the ST91 is a very interesting one, very comprehensive, and involves a lot of moving parts. Can you speak a little bit to the contribution, for example, of just an infection control practitioner at a hospital wants to kind of be voiced so that all of these multidisciplinary and all these stakeholders involved can assure that their voice is being heard, not necessarily just, for example, industry's voices?
Absolutely. And your point about involvement is one of the key aspects of how refined all of the standards are. Our standards are developed in accordance with our ANSI accredited procedures, and it ensures due process, openness, and transparency. Basically, if you're one of the stakeholders, you're commenting along the way, but whether you're one of the stakeholders that are developing it, you always are in a position to comment. In addition, if you have interest in joining, you can just reach out to standards at AAMI.org. And we'll get you engaged. In fact, that's exactly what we're looking for, is opinionated people to come to the table and help forge the best solutions possible. So, for example, the process for ST91 considered and responded to the views of all stakeholders involved in developing the document, and the final standards reflects consensus among experts and stakeholders that the requirements will improve patient safety. Patient safety is all of our North Star, and we collectively stand behind the process that delivers that needed change. But if people have views and they don't get engaged in the process, we're going to miss their brilliance as far as helping to make sure that everything is as optimized as possible. We can't let perfect be the enemy of good, but at the same time, we want these to be as close to perfect as possible. In the case of ST91, it was a 5-year endeavor. 5 years. And it reflects the consensus of the industry, clinicians, and sterilization professionals from around the world. Now, did it have everybody at the table that it ought to? It's a call to action to folks out there that if they have some strong views on how things should be improved, we want them at the table. Please reach out to standards@AAMI.org.
And if they do reach out and are at the table, is there a sense that every person in that room has the same clout? In other words, does everyone have one vote, and no matter kind of who you are, who you work for, what hospital you're a part of, everyone's say is kind of balanced and is equally contributing to the final product?
Yes, but I am going to say some stakeholder groups tend to be reaching out more than other stakeholder groups. So we really need to build the awareness. AAMI needs to help build that awareness so that we get those other stakeholders that we desperately need at the table. Honestly, in the case of ST91, it did have stakeholders from across the industry, and those votes come out. I will offer that you don't even have to be on that committee to be able to comment, and those comments are all taken very seriously.
Thank you for that.
So let's talk about what's kind of coming up. You mentioned that there's some other standards that I think would be really key for people to be learning about or become aware of, especially because we just sort of put it out there about getting involved and wanting that engagement. So what else can they get involved with that might matter, quite a bit to them?
Yeah, absolutely. There are hundreds of standards, by the way. So even if they're curious, they can reach out to us at standards@AAMI.org, and ask if there's any standards being worked or evolved that have already been established in particular areas. But let me mention a few of the new standards that we'll be publishing very soon. One is PB70, and that's for protective barriers. That's a safety standard for apparel and drapes, not the masks. And it's been revised to reflect improved scientific and human factors consensus. So stay tuned for that one. There's also the TIR 104 for radiation sterilization. And these are new guidelines for transferring products from one modality, like gamma, to another, like X-ray, while maintaining the same level of microbiology effectiveness. It is something that commonly needs to be considered when moving products between sites. And there's a lot of that going on when you think of some of the supply chain challenges that have occurred over the last couple of years for obvious reasons. There's also TIR 100 for sterilization assurance. And it outlines an end-to-end process for developing and delivering a sterile product that starts and ends with customer feedback, highlighting the importance of manufacturers working with end users. So we're excited about these new standards that are going to be published here soon. And I will say that this Sterilization Week helped progress a lot of these efforts as far as the work groups convening.
Pam, could you speak a little bit to the kind of business structure and the model that AAMI uses? And I think it is a nonprofit company, but could you speak a little bit to kind of those behind the scenes issues that contribute to making AAMI what it is?
Absolutely. With the nonprofit, we're in a position to be that neutral convener, and we have stakeholder groups, one of which is those that are focused on the standards area. Certainly sterilization is a big component of that, but there's a lot of standards that go beyond sterilization as well. And then we also have the stakeholder group that are on the front lines of care delivery. Those are the individuals that are making sure that these devices work in a quality and safe way on a day-to-day basis when care delivery is being had in hospitals, clinics, also dental clinics too. So from the standpoint of AAMI's role, we're the role of convener and process and education. And as far as how we're funded from the very groups that are our members as the nonprofit.
You know what I really like about what you just said too was talking about the clinics, because this is a growing area, these non-acute settings. And a lot of times the people are wearing multiple hats at these sites, and they have different types of organizations and trying to get them pulled into standards. And then sometimes the standards seem to be built more to the acute setting, especially when it comes to how we kick this off with sterilization. And so it may not always be in exactly the right context for the environment that they're working in, or it may not feel that it is. And so I'm really glad to hear that that's being addressed in sort of that outpatient environment as well, or non-acute setting, because it's a huge glowing area of need, resources for the folks that are out there. Because again, as I said, a lot of them may not be experts in a particular area that they're performing, and yet they're, wearing multiple hats and also supposed to know to the same level of detail for the quality of patient care delivery. I don't know if you want to add anything to that.
I do. I want to give an example too. AAMI is working with the leadership from the American Dental Association to create a new working group focused on creating steam sterilization and sterility assurance standards specifically for dental practices. So you think about it. I went to the dentist this week. When I think of what kind of sterilization practices are needed in a hospital or a clinic setting, you think about it from a dental standpoint, that is a big impact on people's health. And there are more than 80,000 dental facilities across the U.S. Think about it, 80,000. But their operations are on a much different scale than those of sterile processing departments within a hospital. Let's face it, it's a different scope and scale. So you have to be practical around what makes sense in that setting. But you can move the needle in a positive direction and advance how those practices work. There's a need to provide these facilities with comprehensive recommendations They'll be derived from ST79 and more, but we need them to be applicable to that specific environment.
Is there anything in particular that comes to mind that would be different about sterilization and monitoring the sterility assurance in a dental practice as opposed to, say, in an outpatient endoscopy clinic or in a healthcare facility, even an SPD?
But let me be honest here. My background is technology and leadership. As far as getting the experts at the table, this is what we're hearing from our stakeholders as far as opportunity. I'll do a parallel. When I was working cyber practices within a hospital system, there were things that were practical for that hospital system to do. But within our continuum of care, we had 1 and 2 doc practices, meaning these were independent practices, but our patients would get referred from there. What was practical for a hospital system, funding-wise, and how they approached it, wasn't always the same for those 1 and 2 doc practices when it came to cyber. And by the way, cyber affects everything these days. So let's face it, we all have to be worried about cyber. But do we want information to be safe when we go to our primary care physician and there happened to be one of those 1 and 2 doc practices? Sure, absolutely. The same is true with dental facilities. I would offer, I'm not the expert in what that needs to look like from a sterilization standpoint, but I can tell you that the environment that a hospital can provide, or in some cases different clinics, may look the same, may look different in the dental realm. And that's why you have to have specific stakeholders that really understand that environment and the practicality of making things work. Because let's face it, we're not trying to make it harder to have care delivery. We're trying to simplify it. And if we're going to simplify it, it has to be practical. Because let's say in theory land, there's a lot of things that would look good. But when it comes to where the care is being delivered, we need to make sure it's effective and safe. And if we can simplify it so it's easy to do the right thing, we're all going to be better off for it.
Or leveraging technology to put in some checks and balances that help us ensure that as well. So it's not just about the simplicity, but you had talked very early on about artificial. And I'll just say, I think a big movement would be augmented reality, and that would be assistive in helping people. There's a workforce shortage going on right now. Training people and bringing them up to speed to meet the increasing demand for a workforce, especially in the area of care delivery. I mean, it's happening in every industry, but we're going to have to shorten that learning curve, and we're going to have to put in checks and balances. So I can see that opportunity is definitely on the table.
There's complete machine augmentation, which is usually what people lead to, but think of just being able to take an expert and being able to have them be in different locations. And with telehealth, it really has advanced it. I know at Children's Health, in my former role there, we had made so much progress and had gone into the schools. And the reason why I bring this up is here and now we have the technologies to be able to do that kind of leveraging an expert to be able to help give oversight to someone who might be more junior and can benefit from that. I have lots of telehealth examples that came from my prior organization, but I want to point to that because when we're taking and looking at how education happens, how do you educate those that are at the front lines? There's a lot of different tools and approaches that AAMI is looking at so that we can scale those scarce resources that we need to help educate folks from across the globe, but certainly here in the U.S. But as far as working through that augmentation, how do we scale scarce resources? You're also bringing up when it comes to shortages, that's another area that AAMI is focused on, is how do we help match the skill level of individuals coming through the pipelines of elementary and college to be able to feed the workforce. It's a big area that AAMI is focused on. Thank you for bringing that up.
So I guess the last question I have for you, and this has been a great interview, but I want to talk about something that's coming up. And again, staying on this topic of sterilization, but there's a AAMI Exchange in June in San Antonio, and this podcast will release ahead of that event. Can you talk about the AAMI Exchange and then maybe some of the sterilization-focused content that you have planned?
Absolutely. As far as the exchange, we're having a number of the health technology management, those that are in the hospital walls, gather at this conference. And when you think of standards, it applies to them. So there is activity to be able to help orient as well as determine where additional standards need to be set. But relative to our standards efforts, there will be presenters as well as work groups that will be gathered there as well. But let's go back to ST91. And that's really getting into the sterilization around the endoscope reprocessing. That doesn't have a hard, fast deadline from a scope standpoint as far as when that's adopted. It isn't. It's basically saying, here's the North Star, here's how we can improve sterilization in this space. And really, an event like the Exchange coming up in June, please, everyone, plan on joining. I want to say hi to you. Come up and chat with me. I'll be there. But that kind of event is there to educate folks, because the only way these standards will make a difference is in the adoption. And in this case, there isn't a hard, fast deadline that it has to be adopted. It's more of let's influence the industry on how we can move the needle to higher quality and safe care. That's what we all want for our loved ones and ourselves, our neighbors. We want that safe care, and this is going to help with that, and we're going to educate folks around how to make that happen.
All right, Pamela, great interview today. Thanks for giving us some background and doing it so early in your new role as the president and CEO of AAMI, and very much looking forward to more of the updates. And like you said, I just want to remind everybody that if they do want to get involved or they want to learn about certain standards that they could be involved in, because there are so many, an email can go out to standards@aami.org. That's AAMI.org. Really appreciate you coming on the show today, Pamela.
Thanks so much, Justin. It's been an honor, and I look forward to working with you in the future.
That was Pamela Arora, President and CEO of AAMI, the Association for the Advancement of Medical Instrumentation. And Larry, we talked a lot with Pamela today just about her early experience. Obviously, she's new to the organization, but for anybody who wasn't familiar with AAMI, I think this was a nice overview. But I think the most important takeaway for me is just getting more and more involvement from people out there. And it can be industry, but I know there's been a call to action to get more frontline SMEs and just staff to get more involved and have their input. And as our audience is very much infection prevention, not everybody may be familiar with AAMI, but even if they are, maybe they're not as involved and they wind up dealing with a lot of the infections. And as you're very experienced with as it relates to flexible endoscopes, superbug outbreaks, etc., talking about design, talking about reprocessing and helping prevent those very serious complications from infection from happening, getting people's experiences on the day-to-day and working with staff internally and gaining that expertise and understanding the why things are the way they are and being able to bring that kind of insight forward to your organization, I think is critical.
I think there is a process. It's not optimized yet. Clearly, there's still a long way to go. But AAMI is, as we learned and talked with Pam today, they're sensitive to bringing in all the players. And I think that's really an important point in resolving differences and making sure that the guideline is optimized. We talked about the ST91. I think that was very interesting. I wasn't sure we were going to get into the whole issue of the processing of flexible endoscopes. That's a guideline that was just released. And I think she made some very good points about it. And I think the audience will learn a lot about the structure of AAMI, about the writing of the ST91, as well as other guidelines and standards and future standards that AAMI intends to be working on and developing. So I think it was just a fascinating interview.
All right, well, that's going to do it for this week's show. As a reminder, you can support Transmission Control by subscribing on Apple, Amazon, or Google Podcasts, as well as Stitcher, iHeartRadio, Spotify, or simply search for Transmission Control on your favorite podcast application. We also have bonus content available for certain episodes, but you have to download our smartphone app for iPhone and Android. And while you're there, we'd certainly appreciate a rating and a review because your feedback is important to the show. On behalf of Larry and myself, thank you for listening to this week's episode of Transmission Control.